Bismillahirrahmanirrahim and Assalamu alaikum. Dear audience, Assalamu alaikum. How are you? I'm Asma Yunus and I'm presenting the important topic cerebral palsy. Cerebral palsy is a group of permanent disorder of the development of movement and posture causing activity limitation. CP is a motor disorder. The condition involves disturbance of sensation, perception, communication, cognition, and behavior, secondary musculoskeletal problems, and epilepsy. CP is basically a movement disorder, and I am teaching. I have many students with CP disorder, and they have and each child is different from the other, although one is CP but the nature and its characteristics are totally different, and they are also different in cognition, perception, sensation, and behavior. If the one child with CP is hyper, maybe the other child is not hyper. If the one child have good perception about self, the other will not have good perception. Communication, many students with CP has good communication with with mild CP, and others do not have. So it's vary from person to person, and it is the disorder very difficult to tackle for the parents, because it's a motor movement motor disorder, or it's a movement disorder. So it's very difficult for parents to move child from one place to another place. Secondary, cognition problem. CP children have cognition problem. They may not understand what you are saying. You are saying, "Go do this." They cannot understand, and later on, different things. Communication. Some children have speech. They can express their feelings, and they can communicate their message, and others may not have. It's very, and some students have non-verbal communication, and some has verbal communication. And behavior problems also vary. Some children with CPS are hyper, some with CP are not hyper. It varies. Some are introvert, some are extrovert. These are different perspective of the personality. We are not saying the if you have 10 CP in your class. Like me, I have 5 students with cerebral palsy, two wheelchair bounded, and they vary. One is very heavyweight, so the other is very slim smart, and two students, they are walking, they are diagnosed with CP, but they are moving, they have good communication skills, they have good behavior as well, and behave in the class. So it vary from person to person, how different CP we have. Later on in the slides, I will discuss the three types of CP, and I will discuss the treatment. Dear audience, meanwhile, I want to say that if you like my video, please subscribe and share with others. And if you have any query and question, please comment me, I will reply you. And now we are talking about posture. Their activity is limited, and if your child with CP is wheelchair bounded, he is totally dependent on you. You are dependent on you as a parent, as a mother, as a teacher. Like I have two students with CP, and they are wheelchair bounded, so they are totally depend on me. I have to move for the ground activities and different activities. They totally depend on me, and I have to move them. And the one child is having speech, and the other one is not. And she is now, firstly, she is not understandable. Now she is understandable, and she is sitting in on the wheelchair and performing different activities given by me. So it's difficult to understand the child, but not impossible. You have, if you are working with loyalty, with patience, you will show results positive. Will see positive result. And It basically when it's a movement disorder, child is sitting on one place or child is cannot move from one place to another place. His physical energy is not used. He is much bored now. He has many behavioral disorders. Like if you, for example, if you are sick and you are on the bed for 2 weeks or 1 week, you will get tired. So think about this to the child that is CP that cannot move from one place to another place, and he has to take the help of other for movement. So it's very difficult for him to be happy. So you have to take care of your child with CP because he has mental state, different mental state like you. CP can be defined as non-progressive injury to the immature brain, and it's non-progressive injury. Uh, like if you are saying someone has CP, it means it can be treated. It can be, but it cannot be removed. You cannot remove CP from the child. Early signs in the infant. What are the early signs of CP? It's very important. It can be a milestone for your child if he has these early signs: abnormal behavior, excessive duality or irritability, poor eye contact. If your child has these things at earlier stage and poor sleep, it may be sign of CP. Or motor problems, frequent vomiting, poor sucking. If your child cannot suck properly, like he's feeding, it's for the early time period. It means he may be. It cannot 100% true that he is CP. It might be. He might be it is a sign of CP. Tongue retraction. Tongue retraction is another sign of CP. Persistent bite. Persistent bite is another sign of CP. Poor mobility, poor head control. If the child has poor control till a child had got head control at the age of 3 months, also 3 months usually, and if the child has poor head control like in 6 months, it's a sign of CP. It's a sign of disability. It's a delayed milestone. Hand preference before 2 years of age. Mm, Abnormal tone, and your child may have abnormal tone. These are all are the early signs of CP, and it's not the 100% true or 100% sign of CP. These are the suggestive CP. Maybe your child is CP. Another important thing, your child grow with the delayed milestone. He sit late as compared to normal. He walk late, or he walk or not walk. It depends on the level or severity of the disease. What disease he or she, what type of CP he or she has. If you are a mother, you are a child taker, you are seeing these symptoms in your child, you should consult to the doctor. You should consult to the physiotherapist. You should consult to the occupational therapist for these symptoms, that like your child has these symptoms, and you have to check, follow up, and you have to take care of your child and follow up. You should take the follow up from the doctor. These are early symptoms, early signs of CP in an infant. This may lead to CP. These signs can be a warning or red alarm or red flag. There are different types of CP: spastic, dystonic, mixed types, ataxic. About 70 to 80%, most common from muscles, appear stiff and tight. In this type of uh, CP, the child have stiffness in the muscles, arises from motor cortex damage, and it is from the brain part cortex damage. 70 to 80% spastic. Dyscathenic. 6%, characterized by the involuntary movements, arises from basal ganglia damage. And if the basal ganglia is damaged, it means your child may suffer from dystonic CP. Attack 6%, characterized by the shaky movement. And the your child has shaky movements, it means he has CP with ataxic type. Affect balance and sense of positioning in positioning in space, arises from cerebellum damage. Brain part cerebellum is important for the balance. If cerebellum plays a role in the balance balance of the body, if it is damaged, child may have ataxic type of CP. And mixed type combination damage. And we now we are in this slide we know the different types of treatment that we have medication, we have therapy, we have alternative physical therapies for your child. And associative problems with the CP, maybe maybe he has poor vision and muscle problem. These all problems are related to the related to the brain. And if any part of the brain is damaged, leads to the CP. And we have discussed four types of CPs. It's ataxic, spastic, dystonic, and these are different types of CP. And your child may suffer and your child has balance problem. And your child have muscle hard muscle tone, he cannot move, his muscles are so stiff. These are the different types that may your child have. We have different types of cerebral palsy: monoplegic, diplegic, quadriplegic, and hemiplegic. Monoplegic, one side of the body is affected. Diplegic, two sides of the like two legs, lower side is affected. And quadriplegic, in quadriplegic, four types are affected. And we have discussed these early signs before, and here I describe it again because it is very important to know about these signs, like poor eye contact. If your child is not giving eye contact properly in the age of 3 years, or in the age of 6 months or 5 months, and he may have poor sleep, these are maybe a sign of CP. And poor sucking is another sign of CP. And these are many other. Poor mobility, if your child cannot move or cannot take one side, and cannot move from one place to another place, poor head control, these abnormal tone, these all signs are the key signs, or they may be a red flag, or they may be a key milestone on towards the CP. CP. It's very important to know these signs. And if you have seen these signs in your infant, you should consult to the doctor or physiotherapist, because as we have early intervention is very important. If you assess and earlier intervene your child, there are many chances of progression, there are many chances for the better recovery. More the earlier more the earlier assessment, more the earlier assessment, more the earlier intervention, more the progress we can see in the child. We have better in my class I have different students, and the students that are taking those with early intervention, and they are taking services at earlier stage, they are much better as compared to those who came late and got their treatment very late. Their progression is very slow, their recovery chances are very slow. Cerebral palsy, what are the treatment and therapy for the cerebral palsy? Medications. There are different types of medications prescribed by the doctors or a physiotherapist for the this disease, this for this disorder. Surgery. Some doctors advise surgery depend on the level of the child. It depends on the level which type of surgery your physician will give. Equipment. We have different equipments for the mobility like wheelchair and other chairs, and we have alternatives. We have different therapies like physiotherapy, occupational therapy, speech therapy, and other therapies. These all therapies are for the child behavior modification. For CP, you have to follow on these all type of services or treatment. If the child is taking all the treatment or all the therapies, he may recover quickly. In my class, if the child I have different students of CP. I have 5 students with CP, cerebral palsy, and they are taking different services like physiotherapy, occupational therapy, speech therapy, and they are getting very much improvement. And I have seen improvement in their mobility and movement also. And there are many alternatives and different therapies and different methods or exercises given by the physiotherapist or occupational therapist. We have given also the home plan for the child. So we see very much improvement in the students. It's not only the medication work, it's work therapy works a lot. And the work done by the teacher, therapist, and parent, it's a triangle. If we three are working in the same level, we will see the progress in the child. If the therapist is working, parents are not working, the whole whole process becomes zero, the whole progress becomes zero. And if the triangle, if the teacher, physiotherapist, and the parents all are working on the same level, and the parents are following the instructions of therapist, and they are given proper alternative equipment or treatment for the child, and following the instructions of the therapist, they will see very good result and very much progress in their child. One thing more, if you are taking your child to another therapist and you are changing therapist again and again, there will be no improvement in your child, because child is special and he is attached to one physiotherapist. And you have to think about your child, and give you should give respect to your therapist teacher as well. And this result, and you will see the result and improvement in your child if you are giving your child physiotherapy and all exercises practiced daily. And these exercises should be practiced daily as prescribed or by the therapist. Mostly parents, and some parents are not following the advice of therapist, and that is the reason the child get not improvement. World Cerebral Palsy Day. And the World Awareness Cerebral Palsy Day is 6 October, and in this day, and this day is celebrated for the all CP child, and we should respect to our CP child. We should take care of this child. In the end, I want to say, if you like my video, if you have any query, comment and like my video and share it. I want to say goodbye to everyone, and stay happy, stay blessed. Thank you so much for listening. If you have any question regarding this, regarding CP, or any query about CP, or you want to ask any question about your child, you can ask freely. And I want to say, please give time to your child. Your child is special. And if he is with CP, you should give 100% to your child, because he is totally dependent on you. He cannot move, he cannot walk, he cannot uh, he cannot take everything that he wants, he cannot play, his physical energy is not used. So take care, stay blessed. Goodbye, Allah Hafiz, and Assalamu alaikum.